And welcome to this webinar on the intergenerational action for gender equality, health, and UHC. Thank you for sharing your names on the chat. As the messages keep coming in, at least we will get to know who has joined us and where we're all coming from. I think it's important as we continue the collaboration in this multi-sectoral or multilateral system that we are working in. So this webinar is a follow-on from our engagement at Women Deliver 2023. And I can see a few people who are in that session. I think it was a very interesting session. We brought together various stakeholders that were working on gender equity, gender equality, health, and universal health coverage. And we did a session where we had very interesting conversations and good feedback. And we want to share the highlights from our engagement with you all. We want to share the highlights from that engagement and hear from you how you're working on gender equality and health at various levels. And we also want to identify actions that we can all take to better embed intergenerational and life course approaches within this agenda. So like I said before, it's good that we're coming from different spaces. We're excited as HelpAge from this diversity that is represented here today, as was represented at Women Deliver. And maybe Camilla, you could just go on to the Teams chat and let people know to sign in onto Zoom because it keeps popping up. I think it's confusing because the invite came on the Teams message so that we don't lose out on participants along the way. So, so we want to also emphasize that this is the beginning of our conversation. Actually, a continuation of the conversation we started in Kigali, and we want to build on this intergenerational action around these critical agendas. At HelpAge, we don't have the answers. We want to co-create this with you, and we want to share what we have, the knowledge we have, the experiences we have with you, but we also want to learn from you, hear from you so that we can build on this work moving forward. And just from a quick look at where, let me just see. Oh, we've got quite a mix. We've got Scotland, we've got the UK, we've got Rwanda, Zimbabwe, Deutschland, Brazil, Zimbabwe, Brussels, Colombia, Nepal, Toronto, Asia, Southeast Asia, Oceania, Tanzania, Lesotho, quite a nice mix of people, Mexico, Malaysia. So we will learn from as broad a diversity as possible. So we're going to move on to an audience survey, and I'll invite Lena to launch that first survey. And the question is, where in the world are you today? So Lena, please do the survey for us. Lena? Is Lena here? Oh, here we are. So
yes,
please, it's,
yeah.
Okay, just guide us. Lena? Okay, the question is very simple. Where are you joining us? Where are you joining from today? Please make one choice, and we've put the broad geographic regions: Africa, Asia, Europe, Latin America, and the Caribbean, Northern America, and Oceania. Please tick one, and then Lena will read for us where we are coming from today. Have you all voted?
I'm still waiting for a couple of more votes. I think we are in 80% at the moment.
Excellent.
We can carry.
Oops, you're breaking, Camilla.
It's good to see a mix, but I think we can carry on. Thanks so much.
Okay. So Lena, please share with us. So you can see it's on the screen where we are all coming from. Europe is the highest, followed by Africa, then Asia, Northern America, Latin America, and Caribbean. Thanks for that, Lena. So as more people continue to join, we will continue to encourage that we share where we're coming from. But now I would like to invite Camilla to speak to us about HelpAge and the work that we're doing. I'll start it off and then hand over to her. So if you could please share the slides, Lena. Okay, so this is just to tell you a bit about HelpAge. Some of you already know who we are, but HelpAge is HelpAge International coordinates a global network of organizations who promote the right of all older people to lead dignified, healthy, and secure lives, with a vision of a world where every older person leads a dignified, healthy, and secure life. And our mission is to promote the well-being, rights, and inclusion of older people so that we can all enjoy a future free from poverty, inequality, and discrimination. Next slide, please. So our promise is that by 2030, we will have millions of older people enjoying a better quality of life through improved well-being, dignity, and voice. And we will do well to remember that we are living in an aging world, and the statistics show that the number of older people will increase. And so our promise is aligned to this population aging, this phenomenon of population aging. Next, please. And where we work, if you look at this map, it will show you where we work. The orange places indicate where we work, and we've already increased some of the orange coverage in several of the continents. I know, for example, in Africa, the gray space in the middle has recently been covered because we have a new network member from Burundi, and I think I've seen them join the call. And we also have network members that have joined us from different parts of the globe. And basically, we have over 180 organizations in 91 countries that are all working to advance the vision and mission that I shared previously. So I'm going to hand over to Camilla to continue with the presentation of our work on gender, aging, and health. Camilla, over to you.
Great, thank you. Lena, could you just click on the hide box? Just I see there's a pop-up on the screen. But I'm just going to give a bit of background. Thanks so much. I'm just going to give a background on aging in general, and then aging, gender, and health. So I think, as we all know, we're living in an aging world, and today about 1 billion people are aged 60 and over, and this will rise to 1.4 billion by 2030 and to 2 billion by 2050. And today, about 70% of these older people live in low and middle income countries, and that will increase to 80% by 2050. So next slide, please. So in terms of gender and aging, women over the age of 50 account for as much as 27% of the world's female population globally, yet are almost entirely invisible within debates on gender equality in all settings. Power imbalances and gender inequalities experienced by women and girls across their life course can lead to older women facing compounded disadvantage and discrimination in later life. And that includes high rates of poverty and the experience of gendered ageism. And we know that that is particularly the case where women face multiple intersecting inequalities, whether they're related to socioeconomic status, location, access to education, services, support, health conditions, or experience of disability, race, ethnicity, and many more. And what's called the feminization of aging means that while men outnumber women until the age of 50, women outnumber men at older ages, in part due to their longer life expectancies. And this means by 2030, older women will make up as much as 54% of the world's 1.4 billion older people, and 60% of those aged 80 and over. So this growing number and proportion of older women globally really must not be left behind in the movement towards gender equality. So next slide, please. So at HelpAge, we very much embed gender into our work across all of the different portfolios and themes that we engage on. But there are two initiatives that I wanted to highlight in particular, and that is a global initiative around older women in crisis, which is really focused on leveraging our convening role to mobilize collaborative, evidence-based actions across multiple sectors and generations to confront the injustices that perpetuate the exclusion of older women from development processes, and which contributes to the poverty among women in later life that I was talking about. And the second area is around ageism and really addressing the systemic failures. So we seek to amplify the voices of older people to realign the dysfunctional systems founded on ageism so that they better respond to the rights of aging populations. And as part of this, we're seeking to leverage our thought leadership in information, research, and advocacy in particular to challenge the systemic failures for the benefit of older people everywhere in an aging world. So I wanted to dive into a little bit more detail on gender, aging, and health. So the next slide, please. And there's a huge amount, obviously, that we could unpack here. So this is really just highlighting a few key points that we wanted to share today to think about. The first is that women live longer than men, but in part due to this, spend a greater portion of their lives in ill health or with a disability. And at the same time, women of all ages, absolutely including older women, are the main providers of health and care. This leaves older women as being among those with the greatest need for health and care services, yet often the furthest behind in accessing them. And we often see that their needs and rights, including those related to sexual and reproductive health, are being left behind within global health agendas and in progress towards universal health coverage. And this includes and is reinforced by data systems. So, for example, the demographic and health surveys, which provide key evidence for planning health services, usually exclude women over the age of 50 and also men over the age of 55, which means that we're missing a huge gap of how to in knowledge in terms of how and to inform how we can respond to their needs and rights. So we very much agree with others on the call and many globally that progress towards UHC can contribute to a more gender equal world. But this will only happen if we really invest in those gender transformative approaches that meet the needs and uphold the rights of women and girls of all ages, including older women. So next slide, please. So I just wanted to give you a very brief overview, and there's more information that we'll share in the links around achieving gender transformative UHC fit for an aging world and the key components of that that we have outlined. So the first is around championing a rights-based approach to UHC that respects, protects, and fulfills the rights of women and girls of all ages. The second is around investing in inclusive and gender responsive systems that deliver integrated and person-centered care founded upon strong primary healthcare approaches that promote healthy aging for all. And that really must include sexual and reproductive health services that respond to the needs across the life course. It must also include the development as part of the full continuum of care that you can see in the picture of integrated and rights-based long-term care and support systems, recognizing the really profound impact of gender inequalities in the provision of care and the achievement of gender and its impact on the achievement of gender equality globally. Part of it means addressing the barriers, the specific barriers that older people of all genders face to enjoying their right to health and care and support, including those related to the availability, accessibility, acceptability, and quality of services, and related to ageism and age discrimination in the funding, design, and delivery of those services and systems. It also means counting older women, so removing age caps and giving age, sex, and disability disaggregated data. Finally, it's about igniting intergenerational power to really advance gender equality and health for all ages. And we've included a link to our Building Generations Together for Change report and guidance, which has got really practical lessons from how you can build intergenerational approaches into work. So the last slide of mine is just giving a bit of a overview of our engagement at Women Deliver last year. So we participated in Women Deliver alongside a number of network members who are joining today and older women as well. And the aim of our engagement was really to ensure the inclusion of older women's needs, rights, and voices in the conference, and to promote intergenerational action for advancing gender equality, health, and UHC. And we were very pleased, as Carol was saying, to co-host a Solidarity Space event, building on our UHC work, including our briefing that I just went through. So I will stop there. We've got various resources that I wanted to highlight, and we'll put them in the chat, and we can share the slides as well afterwards. But I will stop, and I think handing over to Nardos.
Okay. Thanks, Camilla. I see there are a few hands that have come up, and Rakshanda, you've asked if you could ask some questions. Could you please hold the questions until the end? We will have a chance for a panel discussion, but for now, I'd like us to move ahead, and we will get a presentation from IPPF Africa Region. That's the International Planned Parenthood Federation of Africa Region. They'll be speaking about their work on gender and health, focusing on research on how to integrate sexual and reproductive health into UHC. To present this, we have Nardos Hagos. I hope I've said your name correctly. She's the Senior Advocacy Advisor at IPPF Africa Region. So Nardos, over to you. You have 10 minutes.
Thank you, Carol, and thank you, HelpAge, for inviting IPPF to be part of this really important session, and for also inviting us to be part of the Women Deliver session that you held last year. Just briefly, for those of you who don't know IPPF, we're a locally owned, globally connected movement, and like HelpAge, we work with local partners to provide vital sexual and reproductive healthcare services, but also advocate for the realization of sexual and reproductive health rights. So as Carol mentioned, today I'll be speaking to you about a policy brief that IPPF Africa Region developed in collaboration with the Guttmacher Institute last year. Guttmacher is an organization that works on research on SRHR globally. The piece that we developed was titled How Universal Health Coverage Can Increase Access to Sexual and Reproductive Health Rights in Sub-Saharan Africa. And before we get into the details, I'd just like to share some highlights or overview of the paper. So the paper really highlighted how governments need to integrate sexual and reproductive healthcare into their national health coverage plans, and the availability and affordability of a wide range of health services are really critical for achieving equality and ensuring that needed healthcare is available to all. Furthermore, to fully realize universal healthcare or universal health coverage, comprehensive sexual and reproductive healthcare must be included in any package of health services and be available to all members of a country's population. And for this piece of research, as a basis for what should be included in a comprehensive package of services, we used the example offered from the Guttmacher-Lancet Commission paper and the essential package of services that was developed in that paper. So UHC is not a new topic, as many of you know. It is included in the Sustainable Development Goals under Target 3.8. And the UN Political Declaration on UHC says it's fundamental for achieving the SDGs related to health and well-being. And also calls on member states to ensure that by 2030, universal access to sexual and reproductive healthcare services, including family planning, are integrated into national health strategies and programs. At the regional level of Africa, we also see efforts to include access to sexual and reproductive health services through the Maputo Protocol and also regional policy frameworks such as the SADC strategy for SRHR in the Southern African development region. Next slide, please. So in this policy document, we identified several areas or several gaps rather, that UHC could address if a full package of services was offered, including reducing the high maternal mortality that we see on the continent, increasing access to modern contraception methods, reducing HIV rates, and 60% of new HIV rates on the continent are among women and girls. So it's really critical to address that, to provide services for key and vulnerable populations, as well as to address reproductive cancers such as cervical cancer as well, which we obviously see very high rates of on the continent. The paper that we developed looked at the efforts of 4 countries to incorporate SRH services into their universal or national health coverage plans. I won't go into detail into all of them, but just briefly as an overview, for Kenya, for example, the universal healthcare policy for 2020 to 2030 had a goal of all Kenyans having access to essential quality health services without suffering hardship. And the reproductive health policy from 2022 to 2032 was viewed as a welcome enabler of UHC services or realization in Kenya. However, there were gaps as there was no reference to sexual health or rights, but there were some elements of the Guttmacher-Lancet Commission essential package of services included. Again, for Ghana, the National Health Insurance Scheme of 2003, so 21 years now, has some SRH services offered, but again, these are not comprehensive. And we saw some challenges, common challenges across the different countries in terms of trying to implement or include SRH services in UHC. First of all, as I just mentioned, the full package of services weren't offered, meaning that there's not a holistic approach to sexual and reproductive health services in the package of services offered. Oftentimes, there is inadequate budget allocation to match the needs of implementing universal health coverage, or to match the aspirations, rather, of implementing universal health coverage. There isn't enough research or monitoring, evaluation, and learning at the national level to track progress and gaps and to evolve services offered. And there is a significant focus on women of reproductive age, often missing adolescents and older women as well, in terms of services being offered within universal health coverage as they relate to SRHR. Next slide, please. Thank you. So within the report, we have quite a comprehensive section on recommendations. I just want to share some of the practical recommendations for expanding inclusive sexual and reproductive health services in universal health coverage at the national level. So first, there needs to be an agreement on the comprehensive package of services, in that what services are required, how do they link together, and next, the GLC recommendation and our report recommends that there should be an incremental approach. It will be incredibly difficult for a country to provide all services at once, and so it should be incremental while prioritizing the national needs. At the same time, there should be adequate budget allocation, which looks at the needs for commodities, for investing in staffing and training of professionals. There should be healthcare for all, including key populations and traditionally marginalized groups. And of course, like I said, taking into consideration the life cycle of people who need access to sexual and reproductive health services. Just 2 more points. There should be a progressive policy framework with enabling legislation that is evidence-based and protects and promotes the rights of all citizens. And finally, there should be education and communication for social change, which means sensitization for stakeholders before and during service delivery to reduce misinformation and stigma and to ensure interest in the services provided. I will share the link to the paper, which goes a little bit deeper and shares specific recommendations for stakeholders, including governments, CSOs, donors, and research institutions as well. Thank you very much for your time.
Thank you, Nardous. I think you've covered quite a bit in the few short slides, and you have touched on a very important topic, especially for population aging. And I'll also say this is of particular interest to me because I worked for your sister organization, PPFA, just before I came into HelpAge. So this touches a core nerve. So I will move us into another survey. This is anonymous. I will read the question and invite us all to participate. It is very important and it ties in a lot with what Nardous has just shared. And the question is, how old are you? This is important for us. It is anonymous. We will not get your name. We will not get the details of your organization, but we need to capture this for purposes of developing the data and informing the conceptualization of our work as we move along. So please answer the question. We've given broad age bands, and Nina, you will let us know how we're doing.
Yes, let's take 10 more seconds.
Okay.
And maybe to add as well, the good practice is 5-year age groups.
Yes.
But we've included up to and including 100 years and over.
Yeah.
Which is good practice. So we encourage everyone who's doing programs in this area to definitely do that.
And here comes the results.
Okay. So we have 50 to 59 as the highest band represented today, followed by 40 to 49, then 30 to 39, 60 to 69, and 20 to 29. Oh, and we do have 70 to 79. We have one person. So we have quite a mix in our meeting today. Unfortunately, for sexual and reproductive health and rights, the cap is normally 49 years. And so many people get left out from that statistic. So our partnership, our collaboration with IPPF is very important for that reason. Thank you, Lena. But in addition to that, I just want to say, if you have questions, please write on the Q&A. There's a tab Q&A, and apologies that the translation was not working at the beginning. I think now it is working, and there's there's a prompt, I believe, on the screen. So please just click open or click on Wordly in the top left. So we will move right along, and I would like to invite Camilla, Nados, and Rose to just share. If you could turn on your cameras again. We just want to have a brief discussion on our reflections from Kigali, from Women Deliver. Hi, Rose, it is good to see you. Rose Gahire is the chair of Nsindagiza, which is the Help Aid Network member in Rwanda. So we just want to share about the Solidarity Space event on igniting intergenerational power for gender equality, health, and UHC. So Camilla, do you want to kick us off?
Yeah, thank you. So we wanted to give you a bit of insight into the discussions that took place in Kigali. So next slide, please. So we're going to present them between us and then give a bit of a brief reflection before we have a video and then move into the panels. But we held a Solidarity Space event, Women Deliver, in 2023. It was a Help Aid Nsindagiza, which is our network member in Rwanda, Equality Now, IPPF Africa region, and World Health Organization event with generous funding from AARP. And as we were talking about earlier, the event really aimed to bring together a broad diversity of actors working on gender equality and health to enable advocates across generations and sectors to share ambitions, knowledge, and approaches, and to galvanize collaboration from grassroots to global levels. So next slide. So the event took what was called a buzz, I think some of it's missing, but it's fine, a buzz group approach which was it's a bit like a world cafe. So we had 3 tables all looking at a question each, and we then people would have 20 minutes discussions, and then we would get up and move around, and you could add to discussions and things. So there was 3 questions. One was around how can we better life course approach into gender, health, and UHC agendas. One was focused on collaborative actions that we can all take to advocate for health and long-term care and support systems that uphold the rights of women and girls of all ages. And one was around fostering, how can we better foster intergenerational approaches within our work. So next slide, please. So I'm just going to briefly go through the results from the first question, and we can share these for more, with the webinar recording. But there was some really nice and useful discussions. A question that came up was, are we responding, is SRHR and gender and health discussions responding to demographic shifts, including youth in a huge youth pool in Africa, but also aging populations globally? There was a strong call for embedding tailored and person-centered and intersectional approaches into gender and health services, excuse me, including age and disability, and responding to needs across the life course, as well as building capacity of all stakeholders. I'm going to sit up to listen to me. Croaky voice. Also, very much agreement that community-based services and primary healthcare approaches are really key to reaching all groups. And the need to consider impacts of ageism, both from a younger and older perspective, and to foster intergenerational connections. There was also a point that this can absolutely reduce loneliness, isolation, and ageism. There was suggestion that we use more personal narratives to tell the life course story, including the accumulated impacts of unmet needs, including those related to SRH, unpaid care, etc., and what that looks like across the life course. Also promoting positive discussions around sexual and reproductive health, including menopause and pleasure for women of all ages. And engaging men in life course approaches to gender and health issues, and embracing Indigenous knowledge to address the challenges that many people were identifying. There was a reflection that there was quite a strong youth focus at Women Deliver, and more broadly in sexual and reproductive health and rights spaces, which is ignoring the needs, rights, and voices of older women. And so a call for us all to advocate for age-inclusive approaches in global health movements. And I think agreement that there's absolutely a need to think beyond just health and UHC to address challenges, recognizing that these are shaped by very deep-rooted social and cultural norms and values. There was a really nice reflection that some of the backsliding on gender equality in SRHR mean that we're now fighting for the same rights that older women have fought for themselves in the past. And so an opportunity to learn from each other in these spaces. And how we can most effectively counter this. And yeah, the last one was around engaging and empowering girls and women of all ages, including young girls and older women. And we'll see from the survey that we just did that the key gaps are at those younger and older age groups. And that the voices of women of all ages in their diversity must really be valued and given space. So there's some overlap between the groups, but I'm going to pass over to Rose to go through the findings from the second buzz group.
Thank you, Camilla. Good afternoon, good evening, good morning, wherever you are. I'm Rose Gahira. They said I'm not the chair. I'm the vice chair of Sindagiza. You want Eli? Eli is online. You may take me. So I'm his vice chair. So I'm supposed to talk about question 2, which was about the collaborative action, which can take to advance health and care and support systems that uphold the lives of women and girls of all ages. And that group, there was about 5 proposals which say that we should create space for women and girls of all ages to come together to foster the generational advocacy approaches. And this would involve providing opportunities or creating safe spaces for women and girls of different ages to engage in dialogue, exchange ideas, and learn from one another. There was also another one which said we should be using existing community structure to build trust and respect among generations. This involves tapping into the knowledge and expertise of older women to mentor young and guide young women and girls, while also providing opportunities for young women and girls to share their perspectives and ideas. And also they came out another one which said that we should work closely with media outlets to amplify the voices of women and girls at all ages, and also to raise awareness about the importance of intergenerational collaboration in achieving gender equality and UHC. There should be a need to develop clear goals, strategies, and action plans that outline the roles and responsibilities of different generations in advocating for change. And the last one was to raise awareness about the health, aging, and SRHR for older women. So over to you, Camilla, for the third group.
Thanks. Over to Nardos. Thanks so much.
Thanks, Rose, and thanks, Camilla. Next slide, please. Thank you. So there were quite a number of responses to this question. How can we foster intergenerational approaches to leverage the collective power of women and girls of all ages in advancing gender equality, health, and UHC? So I won't go through all of them, but I will highlight some key ones. So the first is around using a human rights-based approach that fosters shared language and understanding. Establishing an inclusive vision encompassing and acting across all generations. Communications channels should consider disability, technology, and literacy to ensure accessibility. Dialogue spaces should be inclusive and cognizant of power dynamics and how they might interact, as well as biases. For advocacy message development, input should come from a diverse range of voices and bring generations together. And linked to this, they should utilize the lived experiences of women of all ages. And we should also recognize and address ageism impacts on both young and old. There should be research on intergenerational approaches for evidence-based advocacy. And it's important to develop innovative approaches to consider stereotypes of women and girls which affect us all. And then we should also collect disaggregated data that doesn't have age gaps. So as you saw the example of the questionnaire that was just opened up, we should continue to ensure that all ages are represented. Thank you.
Thank you so much. And then I think we were going to just share the next slide, just any overall reflections, I think, from the three of us before we see a video from Gravis and some of their work. So Rose, I don't know if you want to go first, and then I'll pass to Nardos. Just if there was any short reflection from you about the event and Women Deliver engagement.
Yeah, thank you, Camilla. I think one of what I would think of what I saw in that conference was invisibility of older women in the gender space. And what we can do to address that one is to actively promote the inclusiveness and the presentation of older women in the gender equality spaces, that one. And then we would also involve them in the decision-making, older women in decision-making process, and also include older women in leadership positions, because I didn't see them in the space. We are all young, as you saw the summary of what they were showing. We're all young. Most of us who were there were young, and so there was no leadership position in that space in the conference. We're finding most were young women. Again, what we should do to address it is amplifying their voices so that they are visible. What I mean is by creating platform for older women to share their experiences, as I said before, and their perspective is very vital.
Yeah.
And their insights can provide invaluable perspective on issues related to gender equality that may be overlooked. Thank you.
Thank you so much, Rose. And actually, I think you've also touched on what one of my reflections were, which was the need for not just the voices of older women, but also the building alliances across organizations and being visible and coming together in these spaces. We have really benefited, I think, from the engagement there with many on the call today, and also other organizations, including through the Global Alliance for Gender Equality in UHC. So it's been really positive impact we can all have together by uniting, I think. Nardos, I don't know if there's anything you would like to share at this point before we go to more discussion.
Yes, there is. Thank you for, I've been thinking a lot about this, and I hope it doesn't overlap with what you wanted to say as well, Camilla, but I think the space of Women Delivered generally, and also the session that you held, was really important in highlighting and amplifying the voices, messaging, and strategies of young people. And indeed, this is really critical for especially a continent like Africa, where the majority of people are young people, and we are a very young population. But what really came out during the sessions that I noticed was that we really need to learn from each other and share our experiences and share lessons. I think sometimes, our work imitates the real world. Our work is part of the real world, but our work imitates life in that after a certain age, women become erased from the discussion that really impacts them. And on the African continent, in Asia, and in many other places of the world, we come from histories of storytelling, and it's really critical that's really critical for sharing important information and knowledge. And it really got me thinking about how we can use this historical community tool to share, to apply to our work in this area as well, right? How can we value the voices, lived experiences, knowledge, and just lives of people from all generations to advance our rights as women and girls? Thank you.
I was struggling to find the unmute. I think that's really valuable and rich from both. Thank you so much. And I think, yeah, we'll pick up on many of these themes in the discussion section. And if people were also there, please do include in the chat. We'd love to hear that. And people have asked about the questions. If you click on the 3 dots, there's a Q&A section. Please do include questions there, and we can pick them up in the Q&A. I'm conscious that we're slightly behind, but I'm just going to go straight ahead and share a video that we have that we wanted to share that our partner Lina has developed from Gravis in India, and it gives a bit of an insight into the type of intergenerational activity that they're doing. So just give me a minute, and I will share this. So hopefully you can all see it, but please shout if not.
Gramin Vikas Vigyan Samiti, also known as Gravis, is a non-government organization working in the arid zones of India since 1983. With a holistic approach, Gravis focuses on water security, health, agriculture, agroforestry, climate change adaptation, drought mitigation, gender equality, and education. Through continuous efforts, it strives to uplift the livelihood of the grassroots people, ensuring their well-being and fostering sustainable development goals. People living here face various challenges like water scarcity, health disparities, poverty, and lack of infrastructure. Gender inequalities and illiteracy make these challenges even bigger for women here.
पानी नवा दवा करा पानी पीने वास्ते चाहिए धन पावा गाया गोनन पावा नावने दिन भर पानी तो ले जाऊं ताइरा ये पानी पार पड़े को एक दो घड़े को तो
बहुत समस्या रहती खारो पानी आओ तो गोड्डा दुखता लेवर खराब पेट दुखे और पूरे शरीर में समस्या रहती
परेशानी है कोई साधन है नहीं अब फसल होएगा
तो हम पानी लाते थे बाहर से औरतें जाके जब ऊंची आते तो मटका तो हमारा सिर भी दुखता था हाथ पैर सब दुखते थे
ये नहीं पानी आवे वो पिए नहीं बीमारी कोरी टूटी वाला पानी
दुखे
शरीर होई दुखे हाथ होंदुई वे तो पानी टांग कोई अलग रखा
ले जाना पड़े जोत पर ले जाना पड़े फड़ोदी ले जाना पड़े ये तो हमारे अस्पताल है कौन बनावट कौन ले जानी पड़े अके वही जे दुख रात बिरात नाहनु पड़े जे यार टाइम में ते नेड़ो नहीं है.
Poor health is a major challenge faced by women of all age groups. Incidences of frequent droughts leads to unavailability of water and food, causing poor health among them. Gravis uses intergenerational approach to address these challenges by uniting women of different age groups in village dialogues, training and awareness programs, medical camps, and advocacy events. It focuses on improving their health status and livelihood.
मीटिंग रमाइना नहीं चाह समझला पर लाभार्थी चयन करा वही अपन इधर इधर बनावना तो काम कर ले होते मीटिंग में
बेगलंग देख लिया भाई ये बननो चढ़ बिंग बना दे से हां बिंग देख लिया जागे भाई आ चीज बनी को बनी नहीं भाई बेरा बना तो प्रस्ताव लेवा भाई टांका बना तो प्रस्ताव लेवा भाई बाग लगावा जगह प्रस्ताव लेवा.
It doesn't merely provide aid, it empowers by equipping women with knowledge and fostering a sense of solidarity in the community. This creates a ripple effect of positive change.
पुरुष लोग भी पहले जैसे महिलाओं को मान्यता नहीं देते थे, अब वो उनसे सहभागी के रूप में काम करने लगे. कोई भी काम होता तो उनको लगता है कि हमारी औरतें जो कुछ कर सकती, क्योंकि गांव के अंदर जो इतना लाभ मिला था, टांका हो गया, खड़ीन हो गया, तो सब महिलाओं के नाम से करते. तो एक गांव का उत्थान हो रहा, विकास होने लग गया और बालिका और महिलाओं का नेतृत्व वर्धन होने लगा.
In the arid landscape, these intergenerational learning groups have become a space for shared learning where experiences are exchanged, problems are discussed, and solutions are explored.
समूह जुड़ियो जे केम फायदो ही फायदो है. टांका मिल गया, धोरा पाले मिल गए, फसल गणी हुए और फायदो आगे आगे मिलतो ही जावे यार.
कई नाम है समूह रो?
करनी समूह.
करनी समूह कितना सदस्य हो आप लोग?
मैं यहाँ 10 मैंने सीखा हुआ है कि सब अच्छो काम करो और पढ़ाई लिखाई करो, घर में साफ सफाई रखो और समूह में महीने महीने मीटिंग में आओ।
बगीचो लगवाया मन दीदी, बगीचो दियो है मां लगाए हुए, नींबू भी होवे, गुंदा भी होवे, गुंदो सब्जी बनावा, अचार भी गालो, नींबू जो गर्मी में माने काम देवे, दुकान में तो लाता 10 रुपये नींबू देता, और अब हमारे घरे घणी बार लोग ले जावे, मोल भी ले जावे।
महिला आगे बढ़ने लागी, बोलने लागी, बालिका भी जागरूक होने लागी, बुढ़ी बडेरिया भी समझने लागी, एक दूसरे ने पूछ ले भाई के सुविधा है के कुछ करना, बालिका बतावे बड़ी लुगाइया ने, पहला महिला इतनी जागरूक नहीं होती।
With every drop of rain being conserved through installation of various rainwater harvesting structures like takas and khareens, women of Thar are improving the health of their communities. As members of intergenerational groups, they experience a deep sense of dignity and feel empowered as they have a direct stake in changing not just their own but lives of others too. Women once bound by the constraints of desert now stand as a pillars of resilience, their health and well-being flourishing through intergenerational wisdom.
So thank you so much. I'm sorry some people won't have been able to have all the captions in different languages because it's just voice recognized. But thank you so much for that great video, Lena, and about your work. I'll hand over to Carol.
Thank you, Camilla. Thank you a big thanks to Gravis for such an inspiring video. I could watch it again and again, and I hope that it has been inspiring to you all as well. And just to remind you, please put in your questions on the chat. And if you were at the Women Deliver event, please let us know. But now I'd like to open us up for some discussion. We've been listening a lot, and it is now time to listen to us all. I can see some hands going up, but before we do that, allow me to introduce Veronica. Veronica Brown is a Senior Associate Policy and Advocacy at Women Deliver and a member of the Global Alliance for Gender Equality and UHC. Veronica, are you able to get onto the screen? I'm not able to see you. Let me see, probably. Yes, I can see you now. Hi, Veronica. And I'll also introduce Lena. Lena is a program coordinator at Gravis. Lena, yes, she's on. Hi, Lena, it's good to see you. And so we'll start our Q&A session, but before I invite the questions from the audience, and some are on the chat, I'd like to ask you, Veronica, what are some of the reflections that you have on the presentations that we had before from Nados and Camilla, as well as the feedback from the session that was shared by Nados, Camilla, and Rose? What are your reflections and the reflections on the video, considering particularly the relevance of these in terms of Women's Deliver's own work and your work as part of the Global Alliance for Gender Equality and UHC? A loaded question.
Indeed. Thank you so much, Carol. And thank you so much, HelpAge, for inviting me and Women Deliver to be a part of this webinar. I'm really excited to be here with all these great panelists and with attendees. And I know that some of you were also at Women Deliver, so we share that experience of having been in Kigali last July. For those that don't know, Women Deliver is a feminist global advocacy organization, and we advocate to ensure that every self-identifying girl and woman can exercise full control over her body and her life. We're mostly known for our convening power, but we also work and some other things like leveraging global spaces for civil society and grassroots, equitably engaging youth, and resourcing them to create change in their communities, and strengthening coalitions and alliances for gender equality. First, I want to congratulate Dr. Lena and Gravis on this really powerful video and the way it showcases the amazing work of these women and your organization. So there's so many great things, I think, to reflect on in the video, but I think what struck me the most was the way women spoke about bridging gaps among generations and the way women were coming together to share their experiences and discuss problems and find solutions together, building that community. And I think that really cements my feelings on the power of convening and why it's still so valuable, of bringing girls and women together in all their diversity, not just for dialogue, but for action, to connect and to work together and build that sense of solidarity from that. But spaces like that don't always just exist, right? They really have to be built intentionally to support that. And listening to the reflections from the buzz groups and from the HelpAge event at Women Deliver really just cemented some of that for me. Some of the things that really struck out is making sure to provide accessible formats for all ages and all abilities, and making sure that power dynamics are acknowledged and managed so that groups are not invisibilized. And I think this is crucial because you can't change what you don't acknowledge, and changing power structures is really at the heart of achieving gender equality. Some of the things that struck out to me from what Rose was saying is the invisibilization of older women. And I think older women and adolescent girls are especially invisibilized in the life course. And that's why it's essential to really bring them together, to dialogue and to take action and to really foster spaces where that dialogue can happen to understand each other. And this goes for all spaces of convening. And I think it's especially crucial for big ones like the Women Deliver conference, but also for small convenings, for workshops, and our own organizational convenings. This is also something that we try to bring in our work in the Alliance for Gender Equality and UHC. For those maybe not familiar and who might be interested in also joining, the Alliance for Gender Equality and UHC is an organization that is made up of 100 civil society organizations from over 60 countries. And we come together every month to drive collaboration and coordinated advocacy for rights-based gender responsive UHC. Right now, it's being co-convened by Women Deliver, Women in Global Health, Spectra UN, Pathfinder. But one of the great things about the Alliance for Gender Equality at UHC is we really aspire to work within feminist principles. And I think that one of the things that makes it so is the diversity of voices within the Alliance. So we really aim to address UHC at all levels, so in many perspectives, so including youth and older women, persons with disabilities, health workers, other perspectives, because working across sectors, across silos, and across generations is really important. What we also saw in the video is that women's lives are intersectional, and so our advocacy has to be intersectional as well. All these different voices that come together with the Alliance with a shared understanding of bringing gender responsive UHC is really crucial to supporting girls and women. And some of the things that we saw is, women are being affected by all these different factors. And that's why it's so important to come together across all these different sectors, silos, and generations. We saw in the video how women are really being affected by the climate crisis and how it's exacerbating gender inequities for girls and women. And SRHR and bodily autonomy are a crucial part of building climate resilience and safeguarding some of the hard-won gains that girls and women have been able to win and to keep advancing gender equality. I think I'll stop there, and thank you.
Yeah, thank you, Veronica. I think there are many things that you have surfaced, but I think the one that I'd like to reiterate is the intersectionality, because women's issues do not happen or do not occur in linear forms, and we must embrace intersectionality, multi-sectoral approaches to address the issues of women holistically. So I'll move on to Lena. Lena, the program coordinator at Gravis. Lena, there are huge benefits and opportunities for intergenerational action for both younger and older groups, but we know that these come with many challenges. Do you ever find that there are tensions between younger and older women in your work, including in regard to sexual and reproductive health and rights issues? And if so, how do you seek to respond to and address this? And another loaded question. Over to you, Lena.
Thank you so much, Carol. First of all, I would like to thank HelpAge International and Camilla for providing an opportunity to us to help amplifying voices from grassroots level of women from remote villages. And and thank you so much, everyone, for liking our effort. And apologies for those who were not able to read the fonts. We'll be sharing the updated version with you soon. And now I'll be coming to the question that Carol, you asked me about the intergenerational tension. Is in India, yes, that do exist. Maybe because of social norms, I would say. That are here. Traditionally, I think in other countries too, that would be a case where older generation, older women have the power in the family. So there is, a gap between a communication gap between younger generation and older generation. So they do not share each other's problem with each other. So the older women will not feel comfortable to sharing her problem. I mean, admitting her problems that she's facing about sexual reproductive health. Because in older age, there are many issues that women face about sexual and reproductive health, but they do not feel, comfortable in sharing those and discussing those. And at the same time, the younger generation also face, difficulties in sharing their issues with the older one. But to these community mobilization efforts, to like Gravis is doing, creating community-based organization, helping communities in forming these kinds of groups like intergenerational groups. We are able to bring different generations at a same platform where these spaces are used to share their problems, bring about solution. And yes, we have seen in all those villages where Gravis is working a shift. Like earlier, in Rajasthan, where Gravis is working, it's western part of in India, and here women cover their faces in front of males, in front of older women in the family. So now in these ILGs, we have seen that older women are themselves are asking younger ones, their daughter-in-laws, to remove these veils. These are the barriers. So, they are creating obstacles in sharing their experiences, their voices. So yeah. So
okay.
that's
No,
what
go ahead.
No, so it's an existing challenge. It's an issue, but intergenerational group, creating an intergenerational space is a solution to overcome these challenges. I wanted to say that.
Okay, thank you. So we've seen that there are challenges across the ages, and so as we work in intergenerational spaces, we must be extremely deliberate and intentional on how we create the spaces so as to maximize the contribution of both younger and older women. So I'll move on to Rose, and my question, Rose, is as an older woman and someone who has worked on issues related to gender and health for many years, what are some of the biggest gaps you see for older women? And this is from both your professional and personal perspective. And again, considering that for women, especially, the personal is very political. So how would you bring this out from your experience?
Thanks, Carlo. I think professional have been in the medical for almost the whole of my life. So, and personal, I would say what I come across. First of all, is that women experience experience in gender and health issues. They have several significant gaps that affect women. And one of it, as it was said before, there is a lack of research and data on women issues and women diseases, which lead to a limited understanding of how diseases manifest in different ways in women, especially as they age. So this knowledge gap hinders the development of a targeted intervention and treatment for condition that affects older women. Another issue which I've been observed in medical is ageism in healthcare. Most of women face ageism in healthcare settings where their symptoms are dismissed, and sometimes they say, that's old women. When you say I have pain somewhere, they say, no, that's old women, natural aging, part of aging, so you are not sick. And this can result in an, excuse me, in an undiagnosed and misdiagnosis of health condition, leading to an inadequate treatment and poor health outcome. Another issue which I have seen is access to comprehensive care. Many older women also struggle to access comprehensive care. For example, as you said, there is a policy, I think, in every country for screening for cervical cancer. It stops at 49. And they think women over 49, they can't be screened. So you wonder why, while they're still, sex active. So you find there is also that lack of comprehensive care to older women. And then there is also financial barriers. Most women who work in informal or who don't go to work, they lack financial resources. And especially even those who work after retirement, some of their benefits are very low compared to men, which can restrict their access to essential services like medication and treatment. And such a medication, sometimes it's high out of pocket, so older women can't even manage to pay from the out of pocket. Some don't even have insurances, so they can't have medical access when they don't have insurances. And again, I will talk about the intersectionality and marginalization. Older women from marginalized communities also face it. And of course, addressing this intersectionality disparities require a holistic approach that considers the multiple dimension of identity that shape older women's health experience. And lastly, if I conclude, the gaps faced by older women and me myself as an older woman in health, and gender and health are manifest and require comprehensive strategies to address them effectively. So we should be advocating for more inclusive research practices, combating ageism in healthcare, improving access to comprehensive care, addressing financial barriers, and recognizing the intersectionality nature of health disparities, so we can work towards more equitable healthcare system for older women. Thank you.
Thank you, Rose. And I'll quickly come to you, Nados. I'll pick up a question that has come in the Q&A, and then I'll revert to the audience for a minute or two. How would you recommend approaching the budget allocation aspect of this work? And do you negotiate with local bureaucrats or establish institutional arrangements? And this was from someone from Peru, Alejandra Fuentes, wanted to know, how do you bring in the budget perspective into the work that you do?
Thanks, Carol. So the budget perspective really requires long-term advocacy, and it's not just advocacy around budgets. So first of all, it's really important that civil society is engaged in advocacy around the development of national policy. So for example, any universal health coverage policy and any accompanying implementation frameworks. So for example, I mentioned in Kenya, there's universal health coverage policy, and then there's also the accompanying reproductive health policy. So it's really critical that civil society are included in that and ensure that it's comprehensive, first of all. Alongside that, it's critical that civil society are also included in the national budget making process to ensure that the budgets allocated, they advocate to ensure that the budgets allocated are in line with the aims of national policy, because that's often what we see. We see very grandiose, progressive policy, but the budgets don't align. So those two aspects are really key in terms of making sure that we see progressive policy and we also see aligned budgets to implement those policies. Not every civil society organization can work on budgets. It's very technical. It's a difficult process. However, what's key is partnership then, because there are many organizations whose only work it is to monitor and make recommendations around government budgets. So how do you identify these organizations within your country, and how do you partner with them to understand how the area that you work on is being budgeted adequately or not adequately for government, and how can you therefore work with these local budget organizations to advocate for better budget allocation?
Thanks, Nado. So I will turn to the audience briefly. Karerwa Consili, you've had your hand up for a while. Please ask your question or make your comment. And it will be very brief so that we can take, there are two more hands. Karerwa Consili, are you there? Okay, if we do not have...
I think we just need to, let me give them access.
Oh, okay.
There we go. Let's see.
Okay. Karerwa Consili, please speak.
You should be able to unmute yourself and speak.
Yeah, please give Wahirana Rabokomahefa.
Thank you. I had a problem to speak in English, but now I understand. I understand French.
Okay.
Thank you.
Okay, no problem.
No problem.
Yeah. Wahirana, sorry, Rabokomahefa. You have the floor. Okay, as she's going through that, then we have a question. Okay, go ahead.
Yes, I am here. That I am in the car, and
Okay, I think we will pass.
Yeah, maybe not.
Oh, yeah.
I can't take the call because.
Okay, I think we will pass that. There's one question that's been on the chat, and I'll ask Nados to respond to this. Maybe Camilla, you could mute her because we can't.
Yeah, I have.
Yeah.
Thank you.
Okay. So Nadus, there's a question on the chat about the potential risk associated by pressure from conservative movements on public health. So this basically an opposition question and concerning public universal health coverage. What have you discovered, or what could be done about this? And then the next question is, what initiatives could be taken to focus the older women spaces in the upcoming Women Deliver? If Veronica, you could answer that, that would be great. So Nados.
Thanks, Carol. So in terms of increasing conservatism and how it relates to UHC, we found that often these days healthcare and access to healthcare is framed as a morality and values issue rather than a healthcare and rights issue. And this has really curtailed the ability of women and girls to access services that can improve their lives, increase equality, and help them to make informed decisions about their bodies. And we're also seeing this is related to increased stigma around accessing services, misinformation on the law and services offered, and an increase in women seeking services from non-medical professionals while risking their lives in doing so. So in order to counter this, it's really important, I would say, to not engage in a discussion or argument about UHC or healthcare from a values or morality perspective, but really, as we've been saying through the course of this session, is to view it through the lens of human rights and the realization of human rights for all. But it is becoming an increasing problem. And then just finally, just to say, we're also seeing an impact, not impact, but we're also seeing discussions on the language around healthcare. With, we saw recently a government on the continent no longer wanted to use the term sexual and reproductive health and rights because they believed it applied to a key marginalized population. But it really has an impact, a real life impact on women and girls in terms of consent, third-party authorization for healthcare. We also saw during the ICPD discussions, the Africa Review, that a couple of countries wanted to open up the discussion on agreed upon language around gender-based violence. And all of these things have real life impact. And so I think it's really important to also be aware of these discussions and be able to demonstrate the impact that this has on women and girls and their ability to access healthcare. Thank you.
Thank you very much. So we'll have the final response to Fedushi. The initiatives that could focus the older women's faces more in the upcoming Women Deliver. And this Veronica will answer. And unfortunately, we'll have to close it there. We have Rakshanda. If you could kindly write your question or comment, that would be brilliant. Veronica.
Thank you, Carol. I just really want to first comment on what Nardas was saying and how I completely agree that this is an increasingly pressing issue, which is to counter anti-rights narratives that really, at the end of the day, affect the most vulnerable populations. And one of the ways we can really do that is to join collectives like the Alliance. And really, coming in collective allows us to be present at these spaces that anti-rights groups are increasingly invading, and that includes global spaces like the UN, like Nardas was mentioning, like the WHO, and coming together in collective to counter these disinformation and false narratives is really important. So just wanted to put that there before I move on to answer Ferdushi's question. Thank you. I think some of the feedback that from the buzz groups from the HelpAge event are going to be so helpful in really making sure that older women and other marginalized groups are not don't feel invisibilized in the next Women Deliver conference. Things like making sure that you know, as we talked about, creating an inclusive space for dialogue, but also, you know, that there's accessible communications, that the communication channels that we're using to promote the conference and at the conference are accessible to everyone, that it's not just, you know, TikTok or Instagram, that, you know, maybe we need to reassess what we're really promoting so that we bring in those voices. And also, you know, understanding that, you know, the different needs of women, and then going back to being responsive to the needs of women in their life course. Some of the messaging that we can use for the conference really should be, we want to do consultations so that some of it is geared towards older women and making sure that older women's needs and what they hold important is present in the conference. But yeah, I think those are some of the things that we think we can implement for this next upcoming conference to really make sure that we bring those voices to the table, that those voices are present at things like the plenary, like side events, partnering with organizations that work with older women much more than we did in Kigali to ensure that nobody feels invisibilized at the conference. Thank you for the question.
Yeah, thank you very much. I want to thank all of you for your participation. But before we close out completely, I'll just ask Camilla to share the next steps, and then we will close this webinar. I will come back and close us out. Yeah.
Thanks so much. So we just heard a few steps, and I just thank you so much to the speakers today and panelists and to everyone attending. A really rich discussion. I think we've got so many ideas from the buzz groups, but also from the work of all of you partners in these spaces that we can build on. And this intergenerational approach, I think, has a long way to go. So Lena, I don't know if you can share the slide just for our next steps, but we will be sharing the recording from the meeting and the notes as well, and we can share the long notes that we took from the buzz group with even more detail. And obviously tomorrow is International Women's Day, so we are looking ahead to CSW 68, and you can find more about our engagement at side events. I'll put the link in the chat before we close. And I also wanted to flag the Global Alliance for Gender Equality and UHC event at CSW, which we're very pleased to be participating in, Reaching the Last Mile, comprehensive SRHR for all women and girls. There's also going to be a new learning document and video from HelpAge and Restless Development and the University of Newcastle on a pilot project looking more at intergenerational approaches to climate action. So we can share that too. And a reminder that World Health Day is on the 7th of April. And as Alison, I think, put in the chat too, Intergenerational Action Week is on the 24th to the 30th of April. So that's it from me, Carol. I will put those links in the chat. And thank you so much to everybody for your engagement.
Okay, thank you, Camilla. So I'll now officially thank all the panelists, all the participants for attending and staying the course. It's a busy time of year. Your participation has been great. Thank you for the comments and the chat, all that you've written on the chat. We will take it into consideration. We will share the presentation, and we will share the, we will also share the video. There's a question that has kept, or rather a request by Rakshanda to speak about her experience in the country. Unfortunately, the time did not allow. If you could share your comment or a link to what you're doing, if you could share it on the chat, then we'll be able to also share in what you're doing in Pakistan, which I'm sure is extremely important and interesting. So in the spirit of collaboration, please do share with us what you're doing. So have yourselves a very good evening, and thank you for attending this webinar.
Thank you so much all.
Thank you.
Bye.
Thank you, everyone. Bye.
Thank you so much, and for the brilliant video. Goodbye, everybody.
Bye.